folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Can 5 simple stretches stop your shoulder pain? And we're going to tell you how to tell whether or not they'll help.
Right. A little bit of self-diagnosis and a little bit of treatment.
A lot of this is based upon, in fact, most of it is based upon the work of Robin McKenzie. Big fans of his. His book, Treat Your Own Shoulder. Very much worth the price.
Oh, yeah.
I mean, we're going to touch upon most of it today, and you might try what we said, but if you like it, then you may want to read this because it's got a lot of other hints and gems that will help you get through.
And this book is specifically for patients. It's not for the therapist. It doesn't go into detail that using a lot of terminology you won't understand if you're not in the medical field. It is for the patient, the layperson.
You know, I was just reading. They have these on the neck and back and the knee. And they've sold millions of these. I mean, literally millions. So
it's a good book.
It's a very good book. So, by the way, if you are new to our channel, let's get this done, Brad. Please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook, run right over there, and like us over there because Brad and I, as children, it was sad. We had to get puppies just to have somebody like us. Nobody liked us, and we're trying to turn things around.
Right. It's not true, but we still like to say it.
It's still funny, I think. All right, so 5 simple stretches. Now, there's a couple things where this necessarily may not help you. One thing is if you have a rotator cuff tear, weakness in the shoulder, it's unlikely that this is going to help you to any large extent. We got to get that to heal up somewhat first.
Right, so, yeah. If it's that severe,
let's just show a quick test drill, Brad. So one test would be if he holds right here and I push down like this and he can't hold it up, that could be a rotator cuff tear. Another one, if he puts his hands like this and I push in and the one gives in, that's weakness. It could be a rotator cuff tear, so you'd want to go see the doctor on that.
Right.
So, all right, next one, Brad, is the shoulder pain actually coming from your neck? And one way to tell is very simple way to tell is you're going to sit up straight in a chair.
Right.
You're going to make notation of where your pain is at. Okay, so let's say I'm feeling it right here, Brad. I want you to go ahead and bend the neck forward and back like this. And does that pain change? If it's shoulder pain, it shouldn't change.
Right.
It should stay the same. But if you're doing this and you're finding out it's affecting this, then it possibly is from your neck. The
other thing that oftentimes, I think you'll agree, Bob, that you see this too, is particularly with going back, you're going to be limited on how far you can bend your neck, and you'll have some neck pain, and there will be some clear problems that it'll be clear that your neck has got some problems.
Yeah, you possibly could have both too.
Sure.
We definitely see that all the time. You also want to do side bending, and the same thing, you're looking to see, does that change the pain at all? And the last one is rotations. To see, does that change the pain at all? If none of those change the pain and your shoulder is tight, which we're going to show you right now how to kind of tell whether or not your shoulder is tight, then you're going to want to go ahead and do these exercises, these 5 simple stretches. Brad's going to show us how. Can you catch him, Lonnie, over there?
There we go. You can just take a piece of tape. I got a little piece of blue tape here. And with one hand, reach up as high as you can. Put that piece of tape there.
Do it with the good arm probably first.
Good arm first, and then the sore arm, you might find a whoop. Now, I've done with this patients in the clinic, and I just leave the tape right there. And the next week they come in, this one's the same, it's the same arm, and then I'll see this one. If you see this tape getting up closer and closer, so it's equal, then you know.
I think it's a great idea because it makes you feel really good about how you're doing and if things are improving.
Right.
So the next one would be extension, Brad.
Sure.
So a little harder to do, but
yeah, you just do the same thing. You're not going to get as high, obviously.
Yeah.
So this would be my good arm. Extension is not out to the side and not kind of in between it. You want to get it straight behind you like this. And I'm going to see how high I can go. There we go. Now the sore arm. And that would be typical.
Right.
That much difference. And
Not
typically pain associated with it. Sometimes it's just tightness. It depends on your situation.
Now the last one, you're going to have to just kind of make note on yourself. Do you want to show that one, Brad?
Yeah. This one's nice to have someone help you out. I always have my patients, I say, take your thumb and go, this would be my good one, go right up your spine where the bumps are in your spine as far as you can. Can you hold it? Can you mark it there with your finger, Bob?
Sure.
And then a lot of times if you have a sore one, a lot of people have a hard time even getting it to the belt
Sometimes
line.
they can't even get it around the back. I've
Right,
seen it.
yep.
Where they can't even get it back there. So.
But eventually you want to see if you can get that. Now actually my left one's more loose
Yeah, you are.
than my right.
Oh, quite a bit of
Oh,
difference.
isn't
Yep.
that something?
3-4 inches.
Yeah, you can just
So-
do this for the fun of it on yourself. And
So is your
see.
left one more sore? You have troubles with your shoulder a little bit, right?
Yeah, well, I don't know. You know, Bob, that's a good question.
All right. Well, we don't have time to answer it.
Yeah. We got
right.
people. They were looking at the exercise.
All right. So let's start with the exercises. Number 1 is flexion. Now, sometimes people just start off by doing the pendulum exercises where they're just swinging it like this. Now, you're going to do all these exercises 10 times, but you're going to do them throughout the day, 6 to 8 times throughout the day, so you can do them every hour. So it's quite an investment, but that's how it makes it effective. It's that
Sure.
you're not trying to do it just once.
Yeah.
So you're just going to start with one of these, by the way, and once this one gets comfortable, then you'll go to the next one.
Sure.
So, but the one I like to do better than this one is I like to do this one where you're actually going to push down on the chair like this, and then you're going to walk away. And then you're going to walk back again. And this is a great way to try to help set that shoulder down in the socket and also get some flexion at the same time. So you're going to walk away. Again, all this should be pain-free. Do it in a pain-free zone.
Right.
And don't try to wander. I mean, you can bump up against the pain, but don't go any further than that.
Yeah. So Bob's saying if it feels good and you get to here and all of this pain, well, then you just work to there.
Yeah.
And the next time you do it over the next couple of days, you might find that you can get all the way out to here before it starts to pain, or the pain hopefully is completely gone.
And you'll see what happens here. This is kind of a sneaky way of getting motion, because look where I'm at here now. I'm actually that high.
Right.
So,
right.
all right, next one, Brad. So let's say that one is fine. You finally got to the point where you're almost the same on both sides,
Right,
not the tape.
The tape is.
Then you're going to go to the next one, which is extension. So you want me to start this one?
Sure.
So extension, you can do it a number of ways. You can use a broomstick, and you can start working back like this. Like this. My thumb is down.
Yep.
Or you can go up to a countertop or a chair, and you can just dip down like this
Sure.
and work on extension this way.
If you happen to have something like this, you can go like
Yep.
this, and I can
Dip
just squat
down, yep.
down.
That works out really nice. Okay, so and once you start getting extension about the same distance on both sides, now you're going to go to internal rotation. Brad's going to show this one.
I just want to make sure, another reminder, if these create any sharp pain, don't go there.
Right.
These should just be a gentle stretch.
Pain-free.
Yep.
It may take you, a couple days, maybe even a couple weeks to get through some of these.
Sure.
You're really only doing one stretch a day.
For this one, if you use a belt that's shiny, and you'll see why in just a little bit. First, you just loop it so it'll slide through the buckle.
A belt that's slick, right?
Yeah, a slick belt.
A slick belt.
And then, and this is why you have to have a clothing on, because you want it to slip up and down on that shoulder right where my thumb is here, and you simply work up, get a stretch, and come back down. Gently work it.
And this is
stretch.
where it works out good sometimes to say the words pressure on, pressure off, pressure on. When you're saying the word pressure on, that's when you're applying the pressure, and when you say it's off, it's off. Simple as that.
Right.
All right, the next one, Brad, is actually what you're going to do is you're going to lay down on the bed. Once that one's doing fine, and you're going to do what we call active assistive, but you can just grab hands like this,
Sure.
and you're going to start working on trying to get that full flexion here. Working all the way.
The big advantage of laying on your back is there's no gravity. You're working without gravity, and it just makes it easier. You're more relaxed typically.
Yeah, and the muscles don't have to work as hard, so that generally they're going to stay in the socket the way
Yep.
it should. But this is getting you ready for the next one, which is actually going up against the wall. And you want to grab a towel, Brad? So you're going to go, I'm going to actually probably have you do this one, Brad, but you're going to put a towel like this, and you're going to scrub up the wall like this. The only reason I'm going to have you do, Brad, because you're shorter, so
Yeah.
you can go up higher.
So a smooth wall works much better. If you happen to have one with texture, it's not going to work. very well. So
It actually works out fine. I mean, this one's smooth enough.
Right.
Apparently, right. But see, now you're actually having the muscles actually have to work harder, and they have to still do the right things. You know, keep the ball in the socket.
Yep.
And so there you go.
All right.
That's the 5. Now, if you have a little bit of time and you want to start going into some strengthening, then we'd probably throw the wall anchor in there. You want to just show external rotation, Brad?
Sure.
So this is our device. It comes in handy for so many things, but this works really good for shoulder strengthening. So Brad's working on external rotation. So we're keeping the towel there because he needs to keep that elbow into his side.
Right. If the
show
towel drops, that means your elbow came too far away.
Yeah.
You got to keep it right there.
But this is a great exercise for rotator cuff, is to do those external rotations like that. And there's a bunch of other ones you can do too, but this one's worth the price of admission. Yep, because you want to strengthen that core for the shoulder too. So we just thought we'd throw that one in there, give a little bonus, right? We're always trying to give more than expected, right, Brad?
Yep, let you know what's available.
All right, thanks everybody for watching. We really appreciate it.